Hello, beautiful people. Welcome to my channel, Femalehood. I'm Triple A Star, your niece and your midwife. This is a channel we discuss a lot of different aspects of a woman: the physical aspect, the psychological aspect, the emotional aspect, the spiritual aspect. Everything discussed right here. Wow, today we're discussing we're looking at a whole different thing. We're looking at the first aid tips you do from home. These are the procedures and tips you can do from home before you reach the hospital, or avoid reaching the hospital at all. So you learn a lot of stuff that you didn't know of, and help you prevent or stop going unnecessarily to the hospital sometimes, or do something that will help the person as you wait for help or go to the hospital. Stay tuned. And for the first one of the first we're going to look at the first aid tip we're going to look at is nose bleeding. So this is bleeding through the nose, which can be caused by nasal dryness, which can be caused by nasal picking, which can be caused also by some infection or injury to the nose. So here's what you do when you have nosebleeds at home. With nosebleeds, when you're having nosebleeds at home, this is what you do. You have to sit upright and lean your body and your head slightly forward. You sit upright. Do not put your head in between your legs, in between your thighs. Do not bend down like that, or do not lie flat, because that will cause blood to trickle down into your throat, and it will cause vomiting and all those things, and all such discomforts. So after sitting forward, after sitting upright and slightly lean your body and your head forward, pinch, then you breathe through your mouth. Breathe through your mouth and pinch this softy part of your nostrils, the softy part of it, just slightly below the bony part. Don't pinch on the bony part, but pinch on here, the softy part of it. Pinch for 5 minutes, timed by the clock. After 5 minutes, you check. If the bleeding is still there, pinch again for the next 10 minutes. After that, you check as well. But in the process of pinching, you can apply an ice pack if you like. You can apply an ice pack here to reduce on the to constrict the blood vessels, to stop the bleeding, and also to provide some comfort even as you are doing this procedure. So this is what you do basically. You can also use some sprays, nasal sprays, to constrict the blood vessels, but don't use those ones for a long time because they also have their own side effects. So this is basically what you do. Lean forward, pinch the soft part of your nostrils for 5 minutes. You check again. If the bleeding is still there, do it for the next 10 minutes. This will definitely stop the bleeding, unless there are other factors involved. So after the bleeding has stopped, do not bend or lean over, like bend over. Do not lift heavy things. Do not strain your nostrils or carry or strain yourself, because that will provide pressure on your nose, and then it will cause the bleeding again. Do not even blow your nose for some time. Like leave it, like let it don't do anything with your nose, like touching it, poking it, or anything for some time, or for some days even, so that you don't trigger the bleeding again. And then here's what to do when you have done all the applying of pressure, applying an ice pack. You go to the clinic or hospital if you see the following. After 15 or 20 minutes of applying pressure, the bleeding hasn't stopped, you have to go to the clinic. If the bleeding is fast, if it's very fast, you have to go to the clinic. If the bleeding is due to an injury to your face or to your nose, like maybe you had a blow on your head, on your face, on your nostrils, on your nose, you have to go to the hospital. You have to go to the hospital if you feel faint or weak caused by the bleeding. You definitely have to go to the hospital. There could be something more than just a mere nosebleed. So the next one we're going to look at is diarrhea. This is a common happenings at home or anywhere else. So I'm going to share with you basic tips on what to do when you have diarrhea. So diarrhea, this is a condition of having 3 or more loose or watery stool in 24 hours. You cannot have like loose stool the whole day, like once, and call it diarrhea. It's 3 or more loose or watery stool in 24 hours. So it can range from temporary to chronic diarrhea, and then it gets really worse in children, like it's life-threatening in children. So diarrhea can be caused by bacterial infection, fungal infection, viral infection. It can be caused by some condition, some medical condition. It can be caused by anxiety. It can be caused by several factors that can bring about diarrhea. So I'm going to share with you on how to go about when you have diarrhea at home. What do you do? So when you have diarrhea, here's what to do. Have enough rest. Avoid strenuous activity, as that will trigger it to really come out really strong. So, and then after having enough rest, you have to drink a lot of fluids. Drink fluids like soda drinks. There's some books really argue about that, but soda drinks really helps. Like Coke has really helped me like a lot. So Coke, ORS, that one really works also. You can then avoid dairy products like milk, but sour and yogurt are really good. When you have diarrhea, take sour and yogurt. It really help you. So, and then how do you make ORS at home? You make ORS at home with half a teaspoon of salt to 6 teaspoons of sugar. That makes ORS in 1 liter of cool boiled water. So that's what you do. Drink a lot of fluids, soda drinks, a lot of drinks around can really rehydrate you. Tea with ginger and honey also helps, and then also charcoal. The charcoal, you add water to the charcoal and then you drink it. It really helps also. That's a great deal. And then these are things that we have at home. They're always there at home. You always have tea. You always have, like, some people always have ginger. Charcoal is almost always available. So you can drink all those things to help yourself when you're at home. And then what to eat when you have diarrhea, because when you have diarrhea you lose a lot of food content, so you might feel weak. You need a lot of energy to be replaced. You can have bananas. You can eat bananas. You can eat plain rice. You can eat toast bread. Those things, they'll help settle the intestines, even as you have lost a lot of carbohydrates and potassium. So banana, plain rice will really do you good when you have diarrhea. Those are the things to eat. Avoid oily foods, because they'll just trigger out the diarrhea and make it worse. You have diarrhea, drink a lot of fluids, as much as you can tolerate, to replace the lost fluids, because diarrhea is all about losing fluids. So take as much as possible. Even Pelus to take some fluids. This will help you a great deal. And then when you see these signs, seek medical attention. When the diarrhea lasts for more than 3 days, when your diarrhea is associated with fever or a severe illness, or there is blood in your stool, please seek medical attention. And then when diarrhea is with a child who's less than 2 months, get to the hospital and have the child checked out. So that's basically about the diarrhea. Take a lot of fluids, have enough rest, and eat the foods that we talked about earlier. The first aid to do at home, which I'm going to talk about, is fish bone. What to do when you swallow a fish bone, like it gets stuck in your throat or something. So here's what to do. You get a chunk of banana, a large piece of bread, even a chunk of like shima, like a chunk of shima. This you let that chunk sit in your mouth for a few seconds, and then so that it collects saliva. When it collects saliva, you can swallow it. It will go down, and then that fish bone will hook into the chunk that you've swallowed, and then it will go down with it properly. And then another way you can do it, you can drink Coke or any soda drink, and then that Coke or soda drink will break down the bone, and it will make it easier to be swallowed down. You can even use vinegar, like you dilute the vinegar and then you drink it. That will break down the bone, the fish bone, miraculously, and then it will be easy for you to go down. So, and if you do all these things and then the fish bone is still stuck, you can go to the hospital and have you checked out. Next first aid we're looking at is the animal bite. Sometimes seemingly friendly animals or cats can bite or scratch you, and then when you get a bite, this is what to do. Wash the area with soap and water, and then apply pressure if there's bleeding. And when the bleeding stops, you can apply antibiotic ointment, cover it with sterile gauze or clean cloth, and get to the hospital. So sometimes we might tell you that you can get to the hospital if the bite is really big, if it's from a stray animal, the animal that has been acting strangely, or the animal that's not up to date with vaccinations. But then it's just safe and wise to get the hospital with any animal bite, because you never really know what happened between before it were bitten. So just basically what you do is apply pressure, apply antibiotic ointment, wrap it, and get to the hospital. Because when you get to the hospital, you'll be given stuff like anti-rabies. You also be given tetanus vaccine, which will really help you grade you from other illnesses which can be caused by the bite. So the next one, we're looking at insect bites and stings. Usually insect bites, these are disappear, like the symptoms disappear after a few hours or so, and then you might not really need to get to the hospital. But here's what to do when you get an insect bite or a sting. Remove the stinger. When you see it, if you can see it, remove it. And then after removing the stinger, you can use a fingernail or your cut, the edge of your cut, to remove the stinger from your skin. After removing the stinger, wash the area. After washing the area, you can apply ice wrapped in a cloth or a towel to relieve pain and swelling. After that, you can take an antihistamine to release any itching. Then from there, you can get soda, you mix it with water and apply, or get calamine lotion, you apply on your skin. This will relieve the pain and the itchiness. As I get to the hospital, if you have the bite inside your mouth, near your mouth, such if the swelling isn't going down, there's pus coming out of the swelling, you have to also, if you have a severe allergy to insect bites, like you have severe allergy, you get to the hospital so that you be treated in a more professional way. The next one that we're looking at bangs at home. Bangs at home, this is the common things that happen, like when you're grabbing a hot pot to splash water on yourself. These are very common. And then we're going to learn on what to do when you have such. So the first thing that you need to check is what type of a bang do you have. When you get to have a bang, like when water splash on your body, on your skin, when you grab a hot pot or something, then you have, the first thing that you need to do is see what type of bang it is it. And I'll take you through the types of bangs and which ones you can treat at home, and then which ones you really need to get to the hospital. Here is the type of bangs that I'm going to take you through. We'll start with first degree bangs. These are very painful but minor. They turn red and swell. So that's about the first degree bang. Then the second degree bangs are, they form blisters and very painful. Skin will be very red. So the third degree bangs make the skin look white, and then they may not be very painful because the nerves have been damaged. So that's about the third degree bangs. These are really serious ones. So here's what you do. When you get some bangs, you check the type of bangs that you have, and then you when you see these type of bangs, when you see these signs, you really have to see medical attention. When you have a third degree burn, when the burn is on your face, your hands and your feet, or around the joint, you really have to see medical attention. And then if the burn was caused by electricity, you really have to electricity or chemicals, you really have to seek medical attention. Or you have the burn which goes around your feet, around your legs, or around your arm, you really have to seek medical attention. If the burn is 2 to 3 inches, you have to seek medical attention, because if the pain keeps on getting worse instead of better, get to the hospital, because it's really serious. Because some burns really won't need to be treated at home, they need to be treated at the hospital. Yes. Other one, if you see pus or fluid oozing out of your burn, you have to go to the hospital. What to do for the first degree burns and minor second-degree burns at home, run cool water on the burn area for about 5 minutes. After that, apply aloe vera cream, antibiotic ointment, antiseptic spray around the area, then loosely wrap it with a gauze. Yes, and then do not pop or apply butter on the burn area, as it may damage the skin and cause infection. Also, don't apply or don't use cold water or ice on the burn, as it may damage the skin. So that's what you do basically with minor first degree burns and some second degree burns at home. And then, but for major burns, get to the hospital. And some of the cause of the burns really get to the hospital because it's needs medical attention. So the next first aid that we're going to look at is the broken bone or fracture. So these are common injuries that these are common accidents that happen after a fall. You might have a broken bone on any part of the body. So broken bones, wherever they happen or however small they may seem, as long as it's a broken bone or fracture, they all need medical attention. So how do you know that you have a broken bone or you have a fracture? You hear snap noise after an injury or grinding noise after an injury, and then there's swelling or tenderness, pain on the injury site, and then the part that is injured is difficult to move, or there's pain when moving. When you touch the part, there's pain. So that's how you know that, okay, I have a broken bone or I have a fracture on me. So here's what to do when you have a fracture or broken bone. So here's what to do when you have a fracture or broken bone. Remove clothing from that part of the body that has a broken bone. Remove all clothing. After you remove clothing, you can apply an ice pack wrapped in a cloth and apply it around the injured place so that you reduce any swelling or pain. And then after that, do not attempt to reposition the limb or the part that has been broken, because you might make it worse. Just leave it as it is. Get to the hospital as it is. After you do that, put a splint like under the broken part so that it doesn't move, to stop it from moving as it may become worse. You can put it, you can make a splint using a newspaper, a cardboard, wrap it with a tape, or you can use anything around to wrap it to make it hard, then put under the broken part and then wrap it together with the broken part so that it doesn't move, so it doesn't move even as you're getting to the hospital. And then get to the hospital as soon as possible, but don't let the person drink or eat anything, the one who has been injured, in case they might need surgery to work on that broken part. So that's what you do basically with the broken limb or broken arm or something, or broken bone. Don't reposition. Put a splint to stop the part from moving or shaking, as it may become worse than it was. So that's basically what you do. So the next first aid that we're going to look at is poisoning. This usually happens whether intentionally or unintentionally. It can happen in a home setting or wherever, in a workplace it can happen. So poison can either be inhaled, swallowed, can be injected, or absorbed. So poisoning is caused by exposure to harmful chemicals. And then there are several ways of treating someone who has been poisoned. You can treat either by the symptoms the person presents, the age, and also if you know the amount and the type of chemical the person has been poisoned with. So there's several ways of knowing whether someone has been poisoned, because sometimes you might not know because you find the person is already unconscious or something. So there's several ways. You might smell the chemical and the person is breathing. You might see that the mouth is bent. You may see sores around. You may see the skin is swelling. You might have if it's swallowed poison, here's what to do. You remove anything from the mouth. If there's anything remaining from the mouth, And then if you suspect that it's a chemical poisoning at home or anything that is available, you can check on what's available and check on the labels and follow the instructions which are there on what to do with this type of chemical. If it has been swallowed, you can follow on the label on the content. So the next one is the poison on the skin. What do you do with it? Remove all the clothing using gloves so that you don't also get to be the next victim. Remove all the clothing and then rinse the body or wash the body in a shower or using your hose pipe to wash out all the poison on the skin. And then for poison in the eye, here's what to do. You rinse the eye gently with lukewarm water or cool water for about 15 minutes or until help arrives. And then for inhaled poison, get the person out into fresh air and remove anything that may be contaminated. It could be the clothes. Take the person out, remove all the clothes and let them have some fresh air if they inhale the poison. And then if the person vomits, turn his or her head to the side so that you prevent any form of shocking. And then when you've done all of these things, gather anything that would have been the cause of the poison. You gather everything and take to the hospital along with you, because they might be needed to know whatever poisoning, how much was taken, and all such information. And then you really help the person with that. All those things are different types of poisoning, and you handle them as they have come. So the next first aid tip, or the next thing we're going to discuss on is fainting. So fainting is a form of unconsciousness, a brief form of unconsciousness, which is brief and quick. And this fainting is usually caused by low blood sugar or standing in one place for a long time. Fainting can also be caused by a more serious condition, but so you'll be able to see which one is serious and which one is just fainting because of standing or a low blood sugar. So here's what to do when a person has fainted. Position the person on their back, and then if there are no injuries, raise the legs of the person like above the heart level, and then loosen any tighty clothing. Take the person to an area where there's fresh air, but don't try to make the person stand up so quickly, because they might faint again. After you've done that, taking the patient to the fresh air, the patient should be up like within a minute. If the person doesn't stand up within a minute, seek medical help. If the person wakes up within a minute, ask them if they had taken anything. If they had not taken anything, give them something to drink with high sugar levels, as they could have had low blood sugar levels, and also maybe they could have stood for a long time. So if within a minute the person doesn't regain consciousness, call for medical help. The next first aid tip we're going to look at is the sprain and the strain. So these are common injuries that happen around, and I'm going to take you through the difference from how to differentiate one from another. So we start with a sprain. What is a sprain? A sprain is a tear or stretch of a ligament that connects the bone to another bone and supports the joint. So that is a sprain. So when there is a tear, you're more likely to have bruises, you're more likely to have pain, like excruciating pain. You're also likely to have swelling, and you might have it difficult to move the joint. So sprains usually happen in either your wrist or your joint, ankle joint. And then a strain, this is an injury to a muscle or to a tendon, the thick tissue that connects muscles to a bone, and you're more likely to get a strain in your hamstring or on the back, like on your back. So strains cause pain, weakness, swelling. You may even have difficulty to move the muscle. That's what happens with a strain. So the other one, the sprain, that is the tissue that connects a bone to a bone, usually between on a joint. And then for a strain, this is the muscle or the tendon that connects a muscle to a bone. So that's just the difference between the two of them. With a strain, that's where you get muscle cramps. Yes. And then I'm going to take you through how to treat sprains and strains. For mild sprains and strains, here's what you do: rest the limb or the injured part to allow it to heal, and to allow it to heal. After you rest the part, get an ice pack, hold on to the area for 20 minutes at a time for 4 to 8 hours a day. This is to reduce on the swelling, and also give you some comfort and reduce on the pain. Then after that, you can use an elastic bandage or sprint and wrap around the area where the sprain or the strain. This is to reduce on to reduce of mobility and also aid healing. And then from there, you can get over-the-counter medication, Panadol, Brufen, diclofenac, that is to help with the pain and also reduce on the swelling as well. And then for a more severe sprain or strain where you have difficulties moving the body or part, or the pain is so much and the swelling is increasing incredibly, get to the hospital, get to the clinic. You might need crutches or physical therapy to help you with the injury. So that's basically what you do with the sprain. Rest, to make sure you have enough rest. Wrap an elastic bandage on, use an ice pack to reduce the swelling, take an over-the-counter medication, and if these things don't bring it down, or if it continues getting worse, get to the hospital. You may need an advanced treatment care for that, for the sprain or the strain. So we are done with the first aid tips. So different types of injuries that may happen at home or elsewhere, away from the hospital or clinic. So I'm going to take you through the first aid box, what to have in the first aid box. You can create your own first aid box at home, at work, and here's what you have to have in the first aid box, which can help you attend to almost any minor injury or any injury away from the hospital. So your first aid box has to be transparent, and it has to have the following things inside. It has to have adhesive tape, aloe cream, it has to have hydrocortisone cream, and allergy cream, painkillers like Panadol, Brufen, scissors, tweezers, some examination gloves, latex gloves. It has to have you have to add alcohol wipes, bandages of all sizes, elastic bandages, antibiotic ointments, or they all have to be there. So these are the basic things that you have to have in your first aid box, and easy to get around. Gold swabs and even cotton wool, they all have to be there because you might need them or in almost any injury that happens away from the hospital. So thank you so much for staying tuned and getting to know, acquainting yourself with some information that you need for any injury that you may have at home or elsewhere. And subscribe, share, so that others can know a lot of information that they need to have in case they have an emergency at home. Have a lovely time. Love you so much.